Thank you for joining me. This is Dr. Pessin. I'll be talking about glow powder, an innovative teaching technique for infection control prevention. Healthcare-acquired infections are infections acquired by a patient 48 to 72 hours after treatment in a hospital or healthcare facility. They are major contributors to morbidity, mortality, and drug-resistant bacteria. This is such a widespread problem that despite initiatives by the U.S. Department of Health and Human Services to reduce HAIs, 1 in 31 hospitalized patients acquired an HAI in 2015. Infections such as MRSA, Pseudomonas, Candida, hepatitis, and HPV have all been detected on ultrasound equipment. Since ultrasound equipment is in direct contact with patients' skin, sonographers, the ultrasound environment, patients, and machines are all potential vectors or sources for transmission of disease. Interestingly enough, there are currently no universal guidelines for sonography departments regarding infection control protocols. Perhaps after the COVID-19 pandemic, better protocols will be put into place. But at the time of this study, there were no universal guidelines for sonography departments regarding infection control protocols. The purpose of this study was to ascertain how exposure to glow powder influences sonography students' practice of infection control in a lab setting. There is a significant gap in the literature addressing the implementation of infection prevention initiatives and protocols in the sonography department. Areas in a student sonography lab were contaminated without the student's knowledge prior to a lab session. They were, quote, contaminated with glow powder that was representative of germs. This was an IRB-approved study with a sample of chameleons of 23 sonography students enrolled in a scan lab course who had also participated in a presentation on infection control prevention. Glow powder visible with ultraviolet light was applied to 14 different locations at 4 different scanning stations in the lab. The students had a scanning session and after were debriefed using the UV light to demonstrate the areas of contamination, to demonstrate where the glow powder originally was put, where it disappeared, where it spread, or where it newly appeared in the lab. Glow powder placement was documented at baseline and after the scanning session. Glow powder demonstrate visually how the germs spread or were adequately removed. The experiment was then repeated again at a later date. Data was recorded at baseline, observation 1, and observation 2. 68 areas were documented as having presence or absence of detectable glow powder during each session. SPSS and Excel were used for analysis. Descriptive statistics, frequency, percentages used in data collection and analysis. The summary scores of contamination rates of observation 1 and observation 2 were recorded and compared, and secondary spread was documented. Students still need to get better at disinfecting the lab and its equipment. The baseline had 14 original contaminated areas. Observation 1 had 21 locations of contamination, and observation 2 had 12 locations. All in total, 204 areas were examined for contamination. 16 objects were evaluated at 4 stations for contamination of fake germs and secondary spread each time. The overall decrease in contamination rate was 13%, and secondary spread was decreased by 16%. Gel bottles were the most frequently contaminated. The curved 3.5 megahertz transducer was consistently cleaned. So sonographers knew that they needed to clean the transducer. We can see on the left image a curved 3.5 megahertz transducer commonly used for abdominal and OBGYN imaging, that there is glow powder here before at the baseline. However, after the student scan lab session completed, you can see that the glow powder is gone. The students cleaned the transducer. Other frequently contaminated areas were the disinfectant spray, the bed stool, the screens of the machine, the handles of the machine, and the TGC controls. Here's an example of glow powder spreading after students scanned for 3 hours in the lab. Students were initially surprised by seeing the glow powder, and they expressed a desire to improve and be more attentive to cleaning the equipment after use. On the left side of the screen, this was at baseline. You can see the sprinkling. The right image, how the glow powder spread after use. Freeze button on one of the ultrasound machines. 3 hours later, it spread all the way to the TGC panel. Secondary spread of glow powder. At observation 1, there were 13 locations where glow powder spread from one location to another. Areas of secondary spread during observation 1 were the transducer docking areas, the linear transducers, text keys on the keyboard, gel bottles, transducer wires, and the floor. It is likely the contaminated docking station caused the contamination of the linear transducers. Second-degree spread was significantly reduced during observation 2, as only the floor and keyboard showed new contamination. Incidentally noted was glow powder on someone's shoes because they stepped into the garbage can to reduce the overflow of soiled examination table paper, gloves, and paper towels. That was certainly a lesson. In comparing baseline compared to observation 2 and baseline looking at total new and total removed contaminations, it revealed that observation 1 differed from observation 2 with a p-value of greater than 0.0444. Repeating the activity raised awareness and decreased the rate of secondary spread, showing increased compliance with cleaning equipment. Westerway and Basile reported an Australasian study where more people clean wires of the transducer than keyboards, and only 10% clean the keyboard after each patient. Disinfection of sonography equipment and the environment can significantly reduce transmission of HAIs. Students were knowledgeable about transducer disinfection, but needed more education in other areas. Gel bottles, keyboards, docking stations are all noted in the literature and in this study as easily contaminated. Experiential learning is a powerful way for students to learn about infection control. Dale's cone of experience indicates that students remember what they do more than what they hear. Experiencing glow powder contamination in the student lab can be more effective than just hearing about the importance of disinfection in a lecture. Glow powder has been used effectively to train healthcare workers in hand hygiene and nurses in practice of standard precautions. Successful infection control initiatives use a multimodal approach. HAIs can be reducible by 70% if infection control protocols are implemented. And in this particular study, glow powder highlighted the students' areas of deficiency. Implications, recommendations, and limitations. Education about cleaning the ultrasound environment is imperative to students, to sonographers, and any physician that uses ultrasound. Students increased their knowledge and adherence to infection control prevention after this activity. It was a small sample size and hand hygiene was not evaluated. Accrediting bodies for sonography schools and ultrasound labs do not provide enough detail or attention to this very important issue. Glow powder was uniquely useful to teach infection control prevention in the sonography lab. It is not only visually demonstrated how germs can spread, but students were able to realize which areas they were most likely to not be disinfecting properly. Glow powder is an effective technique for infection control prevention education. Thank you so much for joining in this session.